Depending on where you live, access to basic healthcare is free. Well, not exactly free, but covered by some kind of national health insurance scheme. We might take this for granted until we need to go to a doctor and pay for the visit. That's when we realise how important it is to have a system that everyone can access. However, healthcare systems are costly, and in this environment of limited economic resources, they can be challenging to set up. Governments and health organisations have to make tough decisions about where to invest their funds to make the biggest impact. So how do they figure this out? Well, they use what's called an investment case.
Investment cases are used a lot in different governments. World Health Organization does them quite a bit. And the idea is that it looks at building an economic case for investment in a particular disease or intervention. So it makes these sort of various diseases that have different priorities around the world a little bit more comparable in terms of what they could potentially return to the economy.
Jack Hennessy is a senior health economist who spearheaded world-first research by the Fred Hollows Foundation and Victoria University to develop an investment case for eye health.
What this investment case gives us is a return on investment. For every dollar spent looking at an eye health treatment program, what amount of money would we be looking to get back in terms of economic contributions?
The investment case relies upon an economic model which was built to measure the impact of investment in eye health. The model works across 19 of the countries that the foundation works in, including Africa, the Middle East, Asia, and the Pacific Islands. It looks at 3 common eye conditions: cataract, which is the clouding of the lens in the eye; myopia, also known as nearsightedness; and presbyopia, age-related farsightedness. The economic model compares the costs of treatment for these conditions, such as cataract surgery or wearing glasses, to the long-term benefits for the individual and community.
We look at 3 benefit pathways, which is increased returns to schooling, increased workforce participation, and increased productivity while you're at work.
So on one side, you have the costs, and on the other, the benefits. Performing a simple calculation leads to a benefit-cost ratio, which is essentially a number that tells us for every dollar spent, how much the benefit is. In other words, it tells us what the return on investment is, and the results are eye-opening. For cataract interventions, there is an economic return of $20.50. For myopia, it's $10.50, and for presbyopia, $8. These are averages, of course. In some countries like Kenya, the return on cataract surgery is as high as $52. While these numbers seem impressive, it's important to consider, how do they stack up against other health investment cases?
Compared to sort of similar investment cases that have been developed, so things for like cardiovascular health, which has a return on investment of about $10, treatments for anxiety and depression about $4, and tuberculosis vaccines at about $7 return. So they're all much lower than cataract surgery in particular, because we know that this intervention is extremely cheap and quick to deliver.
The modelling shows that investing in eye health delivers a substantial return, especially when compared against other health treatments. How then do communities practically experience the benefits of these investments?
As an example, you could see an adult, say 40 years old in Kenya, receiving cataract surgery. It may actually enable them to return to work. Then they can provide more for their family, they can provide more for their community, and in turn, that will generate economic activity that can lead to better economic returns for the country as a whole. Now we're showing that there are actually these much broader benefits beside just restoring someone's sight that can actually contribute to a government's bottom line, a government's economy, and really grow a population from an economic point of view.
Investing in eye health doesn't just restore sight, it transforms lives and boosts economies. Check out the link in the description below to find out more about the study on the investment case for eye health, or click on the videos on this side to learn more about what the Foundation is doing in eye health.